Close to 1 in 5 Americans are on some form of Medicaid, which is health care the government pays for, mostly for low-income Americans. But could changes to the program soon be on the horizon? In Washington, there is at least some confusion as to what President Trump wants. The confusion stems from what the president said on Fox News recently, a commitment to not cut Medicaid.
It's Medicare, Medicaid. None of that stuff is going to be touched.
Nothing.
You don't have to.
But then, just hours after the interview aired, President Trump endorsed a Republican proposal in the House of Representatives that could be voted on next week that is expected to look at the possibility of changes in Medicaid.
Medicaid has never been on the chopping block.
In recent days, Republican Speaker Mike Johnson has talked about the possible Medicaid changes being eyed by conservatives. They include putting in place new policies like work requirements for some on Medicaid.
If you add work requirements into Medicaid, it makes sense to people. It's common sense.
Democrats, meanwhile, have quickly pounced on the idea of changes in the government health care program, highlighting that Medicaid is a lifeline for many Americans.
The Republican Party is united in their drive to cut Medicaid and rip health care from millions of seniors.
This Medicaid reform debate is really just beginning. It's expected to last several weeks and possibly several months. And if you're wondering why conservatives are eyeing possible changes to Medicaid, it's because the United States Congress is now just beginning to look at ways to pass President Trump's big legislative agenda, which include policies like tax cuts and money for the border wall, policies and programs that some conservatives say need to be offset with changes to other government programs. Joe St. George, Scripps News Group, Washington.